Good afternoon, everyone. I'll be presenting my paper on spectacle-associated trauma, retrospective analysis of visual and clinical outcomes. Coming to the introduction part, the incidence of ocular trauma in Indian population is around 4 to 7%. If we talk about the impact of trauma, though the ocular trauma affects usually one eye, not resulting in a blindness per se, but the impact of trauma in terms of per person loss of work hours and the psychological effect of losing one eye is enormous. So WHO predicts that by 2050, around 52% of the world population will be myopic, and so there is an impending risk of increasing spectacle-induced trauma as well. At present, the worldwide incidence is around 3 to 7% of all the ocular injuries, but there is a paucity of literature in Indian setting. There are concerns with spectacle-induced trauma because it can convert a blunt trauma into penetrating trauma and can induce multiple stellate tears at the same time due to shattering of glasses. So, keeping all these things in mind, we did a retrospective analysis of 11 eyes in our center where the trauma was inflicted with patients' own spectacle glasses or frames. And the parameters evaluated were demographic factors, mode of injury, extent and severity of injury, surgical intervention, visual and tectonic outcomes. The open globe injuries were classified into various types and the zones as per the ocular trauma classification system. Coming to the results, out of 11 patients, 9 patients were male and 2 were females, and they were almost equally distributed amongst all the age groups. And coming to the primary mode of injury resulting in broken spectacles, the fall was the most common cause in the old age group and the sports injuries in the young patients. Coming to the clinical presentation, 10 out of 11 patients had an ocular involvement, out of which 9 patients had open globe injuries, of which 6 had lacerations and 6 had zone 2 involvement. So the lens involvement was seen in three patients and the posterior segment involvement was seen in 4 patients. Multiple tears were seen in 3 patients and glass shrapnel removal was done from 3 patients. So coming to the visual outcomes, almost all the patients had good visual prognosis except 3 cases, case 2, case 5 and case 10. These patients were very severe cases on presentation and had a posterior segment involvement. None of our patients developed post-operative endophthalmitis. We had a wide variety of presentations. I'll be just discussing in a short some of our cases. This was a 72-year-old male who had a history of a fall followed by injury with his broken glasses. He presented to us with a juxtalimbar rupture with PCOL expulsion, and after the surgery, the visual prognosis was good. This was a young patient who had a history of a sports injury. He was playing cricket and had an injury with a cricket ball followed by the broken glasses. This was a 54-year-old male who had a history of fist injury followed by the injury with his broken glasses. He had presented to us with a rupture in a zone 3. This was again a female who had a sports injury. She presented to us with an irregular corneoscleral tear in the inferior quadrant along with a lens involvement. This was a very interesting case of 40-year-old male who was playing badminton and had an injury with a shuttlecock. He presented to us with 2 parallel tears in the inferior quadrant of cornea, where the inferior was full thickness and the superior was lamellar, as confirmed on anterior OCT as well. So while surgery, we planned that we'll only repair the inferior tear, but when we were repairing the inferior tear, the superior was opening, and the superior was opening, and that was also quite deep. And when we were repairing the superior tear, the inferior was opening up. So we passed a continuous purse string suture from both the tears together to help in the initial apposition of both the tears in the initial part of the surgery, which helped us in the subsequent suturing of the individual wounds separately. After the suture removal, the visual prognosis was good. This was a young child. This was a child who had a history of the fall followed by the injury with his glasses. He presented to us with an irregular corneoscleral tear along with a lens involvement. There was a tear in the lid also, and there was a tear in the cheek also. And when we were doing the cheek laceration repair, there was a broken glass particle that was removed from there. So this was again a child who had presented to us with a history of a hand injury followed by broken glasses. As you can see, he had multiple irregular tears in the superior and the inferior part of the cornea. So in this patient also, we had followed this purse string suture technique to help in the initial apposition of the sutures, of the tears. So this was again an elderly patient who had presented to us with a globe rupture in 2 quadrants, and from the inferior part of the globe rupture, a foreign body was also removed. This was a very interesting case, a 23-year-old female who sustained a firecracker injury. She was a bystander, and her broken glass particles went and lodged in the cornea. So the broken glass particles, they were removed as they were involving the pupillary axis. So when we did the literature review, we saw only we could only find the handful of the literature, and definitely there was a paucity of Indian literature. Normally we say the eye protection works, wear it. But does it really work? Let's just discuss a little bit about the impact resistance of glasses. It is basic, impact resistance is basically an ability of a glass to withhold a sudden shock before breaking. It depends upon the material of the glass, the thickness of the glass, the coatings. As we increase the number of coatings, the impact resistance decrease, the frame size and the frame material. So these are the various materials which are being used in making the glasses, and at present the polycarbonate glasses are considered to be the most impact resistant. But considering the amount of trauma that we see in the emergency setting, all of the safety standards of all these glasses, they are not able to still withhold that trauma. So we have the American standards and we have the Australian standards, but we don't have the Indian guidelines as such. So to conclude, spectacle-related eye trauma is a small but preventable. It can convert a blunt trauma into penetrating injury and can also induce a multiple tears at the same time. So whatever we have reported may be just a tip of the iceberg, as most of the time we forget to know, we just note the primary mode of the injury and forget to note the role of the spectacles also. And definitely there's a need of, the need of the hour is to formulate the guidelines for the spectacle material, especially in the Indian setting, as the myopia is on rise, and so the spectacle-induced trauma as well. So this is a detailed data of our patient. Thank you.
Over here, due to paucity of time, we could not discuss the last three cases.